everyone. Myself, Aisha, working as a assistant professor at the Ahmedabad Physiotherapy College. I would like to introduce today's webinar session, which is going to be taken by Dr. Hardik Bhatt sir. Sir is the founder and president at Gujarat Government Physiotherapy Association and also the founder and JAC member at United Physiotherapy Association India. Sir is having the vast experience of 14 years of clinical experience at Government Physiotherapy Hospital, Anjar Kutch, as a physiotherapist. Dr. Hardik Bhatt is a well-known physiotherapy activist who has worked for the several issues like Class 2 post of for physios, Central Independent Council and correction in the Allied Health Bill, Doctor Tag issue and the malpractice, etc. He has arranged digital media support during the EDIFAST, email campaigns for independent council, allied bill, and CA suggestions, etc. He is well-known drafter who draft used by almost all the leaders in the issues like RCI issue, DGTC issue, recent national disability university issues. He always worked for the awareness about direct OPD to physios, initiated public awareness about the fake neurotherapy and the therapy guides via the print and the digital media platform. He is visionary leader who predicted the future of the tele-rehab in 2018 only and implemented Asia's first ever tele-rehab project, Mission Ahalya in Gujarat. Recently, Dr. Hardik Bhatt has elected in Gujarat Council with the highest number of votes. We congratulate you, sir, for the same, and we welcome you for the today's webinar session from the behalf of the Ahmedabad Physiotherapy College and Parul University. Now, sir, you may please start the session.
We welcome you, sir.
Yeah, thank you. Thank you, Aisha ma'am, for a very nice introduction. Thank you, Gaurav sir. Thank you, Parul University, for arranging this webinar of a much needed topic. Am I properly audible and visible?
Yes, sir, you are.
Okay. So today we are going to take a topic, career opportunities and challenges for physiotherapists. As a physiotherapist, thinking about next 5 to 10 years, what will be the career opportunities for us and what will be the challenges for us? We will try to cover in a nutshell. First of all, recently we have introduced Allied and Healthcare Professional Bill 2020 in Rajya Sabha, which is going to implement from mostly from this year only. So this bill is going to be a regulatory body for us. Right now in Gujarat State Physiotherapy Council, which is the only independent council of India, is regulating the physiotherapy professionals. But government has implemented this bill, and this will bring a uniform umbrella type of regulatory body all over India. So first we will begin with this bill's definition of physiotherapist. Aisha ma'am? Yeah. So first page, we are going to begin with who is physiotherapy professionals. So this bill defines physiotherapy professional, a person who practices physiotherapy. And this bill doesn't contain definition of physiotherapy. They have implemented from WHO directly. So the definition of physiotherapy is going to implement from WHO. So physiotherapy professionals are the person who practices physiotherapy, and they take the underlying comprehensive examination and appropriate investigation. So first difference comes from Gujarat state definition. And this definition is that till now, physiotherapists were able to do only physical diagnosis and investigation. Physical diagnosis means that all the MMT test or special test and all the things. This definition includes all appropriate investigation. So we may have a right for other investigative procedures like X-rays and blood tests also legally. Second thing, this definition includes some new terms that is not included in any of the state councils here. That is the fitness and manipulation. So we are expanding our domain, and we are trying to cover the new domain by this forthcoming bill and regulatory body. And first time they have used the word independent practice for us. So still this bill is underway. We don't know how they will form the other rules and regulatory. We are closely following it and trying that it will be in our favor. But this definition seems very hopeful for us for future thing. First, we will have a uniform regulatory structure for all over India, and a body which will make the uniform policies for us. So hope for the best for this. So we will move for the opportunities. Aisha ma'am, next. Yeah, scope of the physiotherapy. So there are scopes, there are challenges. So we are beginning with the positive things. Okay, what are the scopes? So in the nutshell, I have covered few ones like academics, private practice, job in private and government hospitals, corporate, sports, wellness industry, research, and others. First of we will cover the academics. Next. So mostly what the we think, okay, if we want to go to academics or any that means only physiotherapy college, just complete your masters, or if you are bachelors, just do a tutor job. If you are a masters, then join any college and go ahead with this. Now, so this is not the limit for us. Actually, if you are interested in medical subjects like anatomy, physiology, microbiology, and you want a career as a teacher in medical college, so you can still do with BPT. That is one course is MSc in medical subjects like MSc in medical anatomy, MSc in medical physiology, MSc in medical microbiology, MSc in medical biochemistry. These are the subjects which are 3 years of durations and are conducted in few colleges. Like in government, it is there in MSU Vadodara. So after completing this course, you are eligible for the post of tutor in medical colleges. So that is a very good thing, because it's a recent policy from government of India to establish at least one college in each district. So there is a shortfall in getting the medical teachers. Even they are not getting the this medical teachers. So this course is having very good scope, MSc in medical subjects. I don't know, Gaurav sir, whether Parul University is running these courses or not. If it is there, then you can highlight later on. Okay, so you can work as a tutor, but if you do the PhD after completing this MSc in medical subjects, you can even work or promote as a assistant professor and associate professor and higher level, even HOD too. So there is a huge scope in these courses. So those who are especially interested in teaching, I will request them try and go for this also. But just confirm, whenever you are doing MSc, that's confirm the term medical in the degree. Whenever you join the course, there are two type of courses. One is MSc anatomy, and second one is MSc medical anatomy. So the courses which I am talking, it includes the term medical in it, like MSc in medical anatomy, MSc in medical physiology, MSc in medical microbiology, MSc in medical biochemistry. So just confirm the term medical in your degree, and these are the 4 subjects: anatomy, physiology, microbiology, biology, and biochemistry, which you can do MSc and can work in medical colleges as a tutor. And if you complete your higher studies, you can work as an assistant professor or assistant professor. I know I have a few friends, physio friends, who have done this, and right now they are getting a very good career in medical colleges. Okay. Second thing, that is, you can everyone don't have a college, physiotherapy college at their local area, right? That is the issue for some girls or some guys who don't who can't live with their geographic location, and they don't have colleges around this, and still they want a career in teaching. So, and colleges are also limited, the scope is limited, but you can have a career in physical education or sports teacher also. International schools are hiring this type of teachers, and for according to me, physiotherapists are best for it. Okay, we do have an in-depth knowledge of all movements, muscles, even injuries prevention. So just we have to highlight our capacity to them. So that will be a new uh, career opportunity for the guys who don't have a geographic we don't have a colleges, physiotherapy colleges in their geographic location, and still they want to do a teaching task. That will be a simultaneous thing for them. They can have a teaching career, and they can have a as a physio they can carry on practice also. That will be a and one of my friend is doing this. He is a teacher, sports teacher, in one of the reputed school also. So that will be a career scope for us too. Uh, then second one is private university administrator. One of my colleague during election campaign, Dr. Bindes, he is a deputy registrar in one of the private university. So as a physio, even in Tamil Nadu, one of my friend is working as a registrar in private university. So that is also one emerging career for us as an administrator, because we do have a good knowledge of medical field, and if you have a good experience of managing all the things there, that is the also good career opportunity, private university administration level. Second thing is that you can have a career as a resource person for courses, not only for as a physio, but also for other healthcare professional. Recently one of the physio guy has started these things of courses of basic life support. He's teaching to physio, not only to physios, but also the other healthcare professors like nurses and cath lab technicians also. They are attending his course also. He's an MPT in cardiopulmonary. So that is the good career opportunity if you want to uh, uh, do a career in teaching or academics. But for resource person, some type of dedication is needed, because if you want to become a authentic resources person, it may take 6 to 12 months of proper training. You may have to go out of India and receive the training for very good authentic things that need some fund or investment initially, but later on it's very smoothly and good going thing. Next please. Most of the physios are dependent on private practice. Many have a scope of highest income. It is like a sky is the limit in case of private practice. If you are getting proper manpower and proper setups, uh, have many challenges too. But this private practice, and recently it is facing many issues that we'll discuss in the later part of this webinar. Uh, but what is the thing? We have to change according to the time, and specialized theme based clinics are needed, like special for back clinics, special for neurological things. That is already started in some of the metro cities, but still many group C and group T towns lacks adequate rehab services. So what if you are determined that you want to do a private practice, your main focus, your interest is private practice, what I will advise, just choose a correct locations. Instead of having attraction towards the metro cities, I advise for group C and group D towns. They already lack quality rehab service, and already there is ready patients and market for all of you. uh, on the one hand, in the metro cities, it is said that the physio manpower is overflowed. It is it is like more than the demand. It is not like that everyone is getting the enough work. And on the other thing, the areas like I'm staying in Kutch are needing good quality rehab professionals. They are still lacking many professionals. So there is a huge scope for all of you. But just you have to choose the correct location wisely. Sorry. Next, please. Job in private and government hospitals. That is, I am also a government employee. Right now, I am doing a government job. Initially, I was a private practitioner. Then later, I decided to join in government. But it's a very limited scope. Actually, Gujarat is the first state to recruit the physiotherapist at rural level. So we had a chance. So we are fortunate guys who are working in government of Gujarat at rural level. So I got the government job at my doorstep in my town. But the thing, the seats are very limited. We are already working on it to increase the physio recruitment in government. And most of the multi-specialty hospitals are also recruiting us, but they are in very less number. So lack of adequate guidelines which fixes the bed to patient and bed to physiotherapist and patient to physiotherapist ratio. So if there is a 300 bedded multi-specialist hospital, there should be at least 6 physios there, but actually they are hiring only 2 because we don't have any official guideline for it, that this type of this bed needs this number of physios and this number of patients needs this number of physios. So it will be our try of next council body to fix this guideline, so that will automatically increase the number of vacancy in government and private hospitals. So that will help you to increase the jobs in our field. PT can have a multiple role from assistant to neurophysician, spine surgeon to administrative work. Once again, jobs are limited, so physiotherapist can market themselves as a assistant to super specialist like neurophysicians, spine surgeons. Generally, they don't have a time to detailedly assess the patients. So generally, their assistant first assesses them. So physiotherapist can work for their assessment and simultaneously can learn many things from super specialists. So that can be a one opportunity for physios. And as I said, very few government jobs are available. We are trying to fix the problem. But if your target is government job, you have to be a patient, quite patient, because vacancies are very less and the recruitment comes only after 3, 4 or 4, 5 years. And once the job is filled, definitely it is going to be filled for next 20 to 25 years. Next, please. Corporate, yes. This is the sector which can give the huge amount of jobs to us, but highly ignored, because there is a huge scope of physiotherapy. There are some courses like postgraduate courses in occupational health and safety, which can give us so many jobs as a safety officer, health officer, because I stay in highly industrialized area, and I was working to many corporate houses like Welspun Corporation, Jindals, and Adani's. So I know that their demand and how they are managing the manpower. So what I feel at that time, that physiotherapists are very best for them for this job, safety officer, and for health and safety officer, because for industrial via industrial ergonomics we can assure their health, their manpower's health, as well as we can increase their capacity. So and I am doing regular ergonomic workshop for all the industry in group ergonomics. So that is indirectly benefiting to us whenever we need some fund from CSR, like we if we want to do some camps and all that. So this relation is uh, 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 very helpful for us with corporate. So I will advise all my students and freshers that they should try for this. This option is having good scope and also having a good promotion scope for you. Next, please. Sports. Whenever there is a career about sports, then we stuck to MPT sports only. But actually, this is like corporate. This portion also having a multiple possibilities for physios for us. We are fortunate that we are having Swarning Sports University in Gujarat. there are only two sports universities in India. One is Tamil Nadu Sports University, and second we do have in Gujarat Swarnim Sports University. There were multiple short-term courses that physio students should consider. One course is of sports biomechanics. They the person who analyzes all the biomechanics aspect of particular sports and sports person, that is highly demanding. And this is a second course is sports nutrition. Along with the physiotherapy, this course will help us to boost performance of our athletes. Then some of the guys are interested in journalism, and this is the chance. One course is the sports journalism. Every newspaper, every news channel have a separate section for it, and actually they are needing the quality journalists to report this. As a physio, we have a depth knowledge of technical aspect of these things. So if you complete this course, sports journalism, you can build your career as a journalist also. Even some courses are there in sport event organization. That is also one upcoming and growing field. Sports organizations from local level to national to international level scope. So and the second that we are trying at our district also, we are approaching government to establish a disability sports training center here. So disability sports is one of the emerging things right now. All of you know about the para athletes and Paralympic. If you in last Paralympic, India had some good medals. Disabled person brought more medals than disabled normal athletes. So this is on the prime focus of government also. But they need physios. Definitely, they need the good trainers. They need good sports biomechanics. All the things can be specialized to disability sports also. So that is the demanding. That the manpower is in the shortfall. This disability sports courses, currently one course is available in Tamil Nadu Sports University only. Rest you have to gain from your experience. Okay, I advise highly recommend those who are interested in sports, particularly want to build their career in sports, try this disability sports. Next, please. Second is wellness industry. Once again, sky is the limit. We are not approaching to the patients only. We are approaching to the normal people. We are working for wellness. So generally, it is a untouched thing for physios, but it requires some kind of investment also. All of we know about the gyms. We have a plenty of gyms around us, but we are lacking theme-based gyms, like gyms for disabled. Even we feel that all these gyms don't have a proper fitness trainers, or proper guidance is lacking for the patients like PIVD, chronic back pain. So they are good for not normal general people, but theme-based gyms are need of time, like gyms for disabled people only. If you are staying in some metro city, and if you open gym for disabled people, it will be a good thing for them and you also. As a physiotherapist, you know their limit, you know their safety. So that will be a good thing. Second is pediatric gym. I have already done one setup in my government setup. It is a pedo gym, small pedo gym. Actually, we do have one government scheme for malnutrition children. Government gives them daycare stay at hospital and provides a nutritional food to them. So what we call them to my pedo gym also in department. We have a trampoline, we have a mini treadmill, we have a mini cycle, we have a mini stepper, and we arrange some place for them. So this physical activity along with nutrition food is giving very good results. So, and today's era of digitalization and all sedentary lifestyle, pedos are also obese. Parents are worried about their physical activity of their children. So you can open a specific theme-based pediatric gym. That will be a good career opportunity. Third one is fitness. As I said earlier in the starting of webinar, this fitness domain is recently added in definition too. So we are going to be official uh, doctors for this fitness thing. Weight management, it is once again highly demanded. Yoga class, this is the thing that is not only along with your private practice, you can do this thing and have a very handsome money, because we need a quality yoga teachers. So what we are getting in our clinical setups, that people are actually getting injured while doing yoga. Many back pain patients, PIVD patients, even recently I had a patient. He's a medico. His yoga instructor had done Sirshasan for him, and he got a cervical disc problem. So if as a physio plus yoga, that ensures the safety, and specific patient specific plan will boost the market. Already yoga have a very good market and career scope. So this is the thing we should, as a physio, capture this thing from the market. This physiotherapists are best yoga teachers. Next, please. Research. Many guys and girls are interested in research. They do like this one, but as a physio, doing research in India is a very rare thing, because earning bread and butter from it is very difficult. But some courses are there in medical research. Actually, medical field is growing like a bamboo tree since last few years in India after this corona pandemic. So they are lacking proper medical fellows that are dedicated for medical research. As a physio, we are well aware about all the medical terminologies and most of the medical conditions. So if we do the course in medical research, some of the online courses are also there. Career, as you can start your career as a junior research fellow in any of the pharma company or a lab, then you can progress. Now, there is really lack of manpower in medical research field. Next, please. There are few options there you can consider if you are interested and you love to interact with the animals. Then veterinary physiotherapy is a really good scope, because in India there are higher number of animals than humans, and currently in the metro cities, all have a pets. All pets have an injury or fitness issues, because they love their pets. They overfeed them. They are overweight. So along with you can include along with this is a fitness aspect of animals also. And in abroad we have a veterinary gyms too. So you can combine all the things if you are interested in. And it's veterinary physiotherapy. I think I'm aware about only one veterinary physiotherapy in Ahmedabad, which is very rare thing to get there. And he's getting very good fees for his work. Once again, fitness and sports coach, physiotherapist, he's a movement scientist. He has an in-depth knowledge of all the muscles, movements, injuries, and he can also plan to prevent the injuries. So as a fitness and sports coach, physiotherapist is highly recommended. Next, please. Right now we are coming for challenges. So that is the full of challenges. Right now, whenever I talk to the students, most of you are you all may be in the physio student groups, right? So every day new challenge, every day new issue. But we are taking all the main issues in the nutshells. First thing is fun. Next, please. What is the physiotherapy treatment cost for patients in India is quite lower compared to other countries. Still, patients feels it's a burden. They can pay a huge amount when he or she is admitted in hospital for a very small illness like fever and diarrhea. but this still they feel that they are paying more for physio. That is because most of the payment to physiotherapy is from direct patient's pocket, because most of the insurance companies don't cover the physio post treatment, or very limited portion they cover. Either they cover the 1 month or 15 days of initial treatment, or and the amount is fixed for them. Even in the government companies or central government companies which provides insurance for their employees, the portion of physiotherapy they provide or rehabilitative service they provide is very limited. For one example is PGVCL or UGVCL, you can say it's GB, Gujarat State Electricity Board. So physiotherapy treatment charge is very less. They have fixed 100 rupees or even 50 rupees for CP. That is quite insufficient. So most of the fees the patients have to pay from their pocket. So there is a problem of this burden of treatment comes in between. Even government schemes, government runs some schemes like Niramaya. Niramaya scheme is basically for the disabled children. They provide 1 lakh insurance to the all the disabled children, but out of 1 lakh they provide 70,000 for corrective surgery and 5,000 for physiotherapy every year. So that is very less. We are eating head of this trust, Niramaya Trust, who runs this policy. That physiotherapy is a daily need for disabled people. Surgery is a quite rare thing for them. So at least they should increase the physio portion in it. They should have at least 40 to 50,000 claim per year for this scheme, and it is very good scheme. Only in the 250 to 500 rupees the government is giving this insurance. Niramaya. Second is Bal Sakha. You all must have heard about the Bal Sakha Yojana. If any delivery is there in government hospital and the infant baby or neonate is having any trouble, hypoxia or any birth related trouble, he is referred to pediatric hospital. So he is getting assistant of 49,000 for 7 days. Even if he or she is admitted for 1 day, government pays them to 49,000 rupees. And in this Bal Shakha, recently they have added to the early intervention things also, because physiotherapy as early can play important role in early intervention by identifying the high risk children, because most of the CP childs and delayed development and issues and autism and all the issues arises from this level also. So we are also writing government to include us in Bal Sakha Yojana also. So government schemes like Niramaya, Bal Sakha also have a very less coverage or almost no coverage to us. Third thing is investment versus return ratio. If I want to open a clinic in Baroda, I need a good space. I need a good instruments, a good interior. So whenever I compare the investment versus return, what I am investing, what actually my working hours is also investment for us, for me, because I am doing nothing and investing the whole work in my clinic. So investment versus return issue is there. We are as a physio, we are not getting the enough return what we are investing in there. There is high rate of property and high rent issues are also there. But so this is the issue that patients is having trouble in paying to us. We are getting less funds in our hand. Third one is we are not getting any assistance to invest such high things. For example, some schemes are there, like from Bin Anamat Ayog, they give loan on just 4% interest rate. 4% interest rate, that means almost 200 rupees per month, 1 lakh rupees. So if we are getting such loans from government or bank institute, that will be a booster for freshers and us, that we can begin with a proper setup, and there will be a less financial burden on us. So some schemes like loan from Bin Anamat Ayog gives just 4% of interest rate. Many schemes of disability affairs should be extended to set up PT department. Government is highly worried about disabled people. they run plenty of scheme for disabled people. So we should approach to the Disability Affairs Department of Government that physiotherapy helps them to work for their work on their maximum capacity. We can make disabled differently able. Just include us in welfare scheme of disabled people. So as a government welfare scheme, we can get the funds easily, even some equipments with less tax on it. So on the less cost, we can buy the rehab instruments or exercise equipments. No interest EMI should be promoted for instrument purchase. We can have a no cost EMI when buying AC, fridge, or many electronics item. So such things should be promoted for physiotherapy instrument also. So the freshers or who want to who have a less capacity and still want to arrange for a fund can have a help for it. Next, please. Referral practice. So this is the issue. I think everyone is well aware about it. This creates issue many times is location of clinic, relation with the referring doctor, right? Especially in the metro cities. For example, you are sitting and you are having a super specialist near you, but they have a preference for some specific person. They refers to them. So this is the issues. Locations of clinics sometimes, relation with the referring doctors. Some ask for even referral fees or lower rates for patients. This is my personal experience. The doctor or medicos who refers patients to us, they have expectations that you should charge less with them. This is the issues we are facing. Some set up their own department with hiring freshers in low pay. We know some ortho hospitals and multi-specialist hospitals set up their own physio departments and hire the physio on lesser pay. They charge very handsome amount from patients. Even currently, they are hiring physios in COVID setups with very less pay, but they are taking very good charge from the patients. So this bridge should be broken. Direct OPD to patients, and we should have a platform, a national or state level platform that can bridge the need of patients and therapists directly without any third party in between. So that will solve many of our issues. But unfortunately, we are lacking any strong national or state level association. It is the work of association. Next, please. Quality instrument. This is the thing that should be considered as soon as possible. And as a new council members, we will try to focus on it, because there is no regulatory body to cross-check or cross-verify or to form the proper norms for quality instrument of physiotherapists. You can see every 6 to 7 months, some of new company arises in the market. They sell few instruments, then they are out from market. Many times physio lose their money in buying such instruments. They are not getting proper service from instrument provider. So there is no third body, third party, any association or any work from the council to catch such companies and assure the proper quality of the instrument. Commonly used instruments lack precise features like traction. When we have generally talk about the Indian tractions, they just talking about intermediate traction. They just give traction and then release traction, and actually the release portion should be gradual, stepwise. For example, if you are giving 35 kg for back, then 10 kg should be released in the first 10 seconds. Second 10 seconds should be again 5 kg. The releasing process should be stepwise, gradually. That is more scientific. But what Indian instruments do? So proper features, scientific features will assure patient safety plus proper outcome results for us. As I said, no lab for cross verification of results. Recently, we want to order one ultrasound instrument. So I asked about peak accentuation ratio of machine to almost all companies, and none can give satisfactory answer. And this is the ratio which can give us idea about the actual output of that machine. So we can judge the speed of the machine and judge about the safety of the patient. So there are many things that is not assured in things of instruments. So that should be a thing of priority for upcoming regulatory bodies and for us also. Next, please. Lack of brand physio. This is the root level cause of many issues because we have to go to the common people in their own language. Many times, many students and all the complaints that all consider as malish wala, kasrat wala. But this is our fault. We are no. We are not going to the common people in their common in their own language. We have to create one brand physio that it is inevitable. There is no option of it because the many things we are doing are in the multiple domain, like exercise is in the domain of yoga people also, gym people, fitness trainer, all are doing this. But as a brand physio, we can fix it in our domain. We are superior than all other things. Collective efforts are needed to establish our domain. All the things we are trying to do since last 3 years via our social media of Gujarat Government Physiotherapy Association. We want we are creating a local we are by creating local repo with local media, and whenever we have a chance, we went with them and explain all the things in their own language and trying to create about brand physio and awareness. Like last 2 years back in Uttarayana, we celebrated vitamin D awareness along with Uttarayana, and we went for schools. We went to nearby colleges and explained societies even, and explained about importance of vitamin D, our tradition of Uttarayan, and collected it with physio brand. So this is needed, but unfortunately we are lacking in a strong national level and state level association. So you guys all have to create the collectively brand physio. I advise whenever you go, whenever you settle down, just have a regular get together, have a good repo among all of you, and try to create these things. Next, please. Malpractice. This challenge is at a multiple level because lack of strong laws and strong association. Physio instrument in multiple domain. That is the thing to be considered seriously, because MD, PMR lobbies claim their domain on our instrument. A few days back, drug regulator of India published one notice in which all the physio instruments were categorized in PMR department, physical, medical, and rehabilitation department. We had a very strong objection on it, and probably we are getting our separate category in it shortly. But this is the thing. Exercise again in multiple domain. I said exercise domain falls in us also, in yoga guys, fitness guys. Lack of awareness about prescribed exercise. All of love the babas or the guys who teaches nice exercises on YouTube, on videos, but there is a lack of awareness about prescribed exercise, that you are a unique individual, a unique structure formed by the God. So your needs are unique. You need a prescribed exercise for very with the help of prescribed exercise, you can gain your goal without injuries, with very less effort, and in very less time. Use of similar words like therapy and neurotherapy. We had a very huge campaign 2 years back in media that physiotherapy ne bharta namothi thati sharvarthi savdhan. When people use similar words like therapy, neurotherapy, all are nonsense things, because they are not any scientific things in it. Still, they catch our patients and divert our patients. So what is the solution is council plus clinical establishment act is the solutions. Unfortunately, we objected Clinical Establishment Act 2 years back very blindly, but this is a very powerful thing. It allows only system of medicine guys to run clinic. So any neurotherapy or therapy guy is running clinic and claims he treats hypertension, back pain, we can have a direct action, because neurotherapy is a no system of medicine. There are only Ayush and allopathy are recognized system of medicine. Physio, as a Gujarat Council definition, is a branch of allopathy. Evidence-based practice. That is the once again a huge challenge for us, because we see even the qualified therapists do some wire treatment many times. They do electrical stimulation in our upper motor neuron cases also. So there is a lack of protocols. We need once again I'm saying it is a need of time. We should have a very strong national or state level association who should prepare all these protocols. Lack of protocols, apathy among clinical therapists regarding the updates. So many clinical therapists are well settled. They are not interested to update themselves on the recent updates, recent evidences, recent research. Continuing education system is lacking for this clinical therapist guys. But there is a new ray of hope from recent online trend of webinars and discussions. All are joining it and trying to improve by themselves. Hope for the best for the future. So this was the in nutshell about the future future career opportunities and challenges for us. Any questions will be welcome. Aisha ma'am.
Yes, sir. So right now, as of now, there are no such questions
Okay.
from the student side.
Yeah. Yeah.
So we conclude our session over here.
Yeah.
Thank you, sir, for the informative session on the career opportunities and challenges for physiotherapists. I hope this has broadened the views of the job prospect for the students as well. Thank you, sir, for this session today.
Thank you once again, Aisha ma'am, Gaurav sir, Parul University, for arranging this nice webinar. And once again, I advise all the students, just fix it your goal from right now, in
Yeah,
which way you want to go, and prepare on that way only. So that will save your energy and will boost your career. Yeah, thank you.
definitely, definitely. Sir. Thank you, sir.